how fluoroscopy works and its benefits and risks. In 1895, Wilhelm Röntgen published On a New Kind of Rays, the first article on X-rays. This generated great interest in the scientific community. Only 4 months later, Thomas Edison discovered that calcium tungstate produced a brighter image. This led him to create the fluoroscope. 2 months after the discovery of Edison's fluoroscope, the new invention was already in production and was used on the battlefield to locate battle wounds. X-rays are created by accelerating electrons from a heated cathode towards a metal anode by creating a large potential difference, also known as voltage, in a vacuum X-ray tube. The electron current can be manipulated by changing the temperature of the filament. This affects the intensity or the brightness of the X-ray beam, as the hotter cathode will release more electrons. The potential difference or voltage across the tube determines the kinetic energy of the electron as they strike the anode. The higher the kinetic energy, the more the X-ray photon can penetrate. The X-ray photons are produced whenever a fast-moving electron is deaccelerated. The bombarding electrons would knock the inner shell electrons out of the atom of the anode. Then the electrons from a high state drop down to fill the vacancies, in the process emitting an X-ray photon. Most of the bombarding electrons' kinetic energy is turned into heat, but 1% is turned into braking radiation, which are useful. Fluoroscopy is a medical imaging technique similar to X-rays, but shows a continuous X-ray image creating a video. An X-ray beam passes through the body or a contrast agent to a monitor, which will render a moving image in detail. Because different tissues have different densities, more dense materials will absorb more X-rays. This means more dense tissues in the body, like bones, absorb more X-rays, creating dark spots. A fluoroscope captures the X-ray beam and increases the intensity of the image through an intensifier. An X-ray intensifier works by converting the X-rays into visible light. The cesium iodide input phosphor converts the oncoming X-rays into light photons, which are then converted into photoelectrons inside the photocathode. The electrons are then accelerated and are focused by a sequence of electrodes that will strike the output phosphor. The output phosphor converts the electrons into light photons, which then are captured by the camera. The coulometer is a circular or rectangular device which matches the shape of the image receptor that limits the patient's exposure to the X-ray field. If the doctor wants to limit the field of view to reduce radiation exposure, the coulometer blades will move and adjust the field of view to reduce spillover radiation. The job of the coulometer is to minimize radiation exposure by reducing the field of view but still keeping a high resolution. As the body can scatter X-rays, the anti-scatter grid captures the scattered radiation emitted from the X-ray tube before it reaches the image receptor and refocuses the beam to increase contrast and resolution. There are many benefits to fluoroscopy and is used to give diagnosis and perform complicated procedures. The main uses of fluoroscopy are observing the intestine movement by ingesting barium, the densest and least toxic liquid for humans to swallow, locating foreign objects inside the body, image-guided anesthetic injections for joint and spine surgery, catheter insertion in blood vessels, bile ducts, and urinary systems, and anagrams which help visualize blood vessels and organs. Even though fluoroscopy has many benefits, it also comes with some risks. The radiation dose that the patient receives depends on the individual procedure. However, fluoroscopy emits a high dose of radiation compared to other procedures and can result in radiation-related risks. These include radiation burns to the skin and underlying tissues and radiation-induced cancer. However, the probability of someone experiencing these injuries are very low, and to minimize these risks, the procedure should always be conducted with the lowest exposure to radiation and in the shortest time. Overall, fluoroscopy has helped millions of patients worldwide and has allowed doctors to easily examine the body. Even though fluoroscopy used to be incredibly dangerous for doctors due to inadequate radiation protection, recent technological advancement within the radiology community has helped improve safety standards around the globe.
Created using Powtoon.